Okay. Assalamu alaikum everyone. Bismillahirrahmanirrahim. Quote of the day: every small positive change we make in ourselves repays in confidence in the future. Today, the topic of my presentation is roundworm, whipworm, hookworm, and I'm presenting it under supervision of my professor, Dr. Shah Afzal. Learning outlines, following aspects of roundworm, hookworm, and whipworm would be covered today: introduction, global burden, epidemiological chart, clinical features, diagnosis and treatment, prevention, and recent updates. Learning outcomes. By the end of this presentation, participants would be able to describe roundworm, hookworm, and whipworm along with their levels of prevention. Now, Ascariasis, hookworm, and whipworm are parasitic worms that are known as soil-transmitted helminths because the infection spreads through contaminated soil. Now, first we will discuss about roundworm, which is also known as Ascaris lumbricoides. This is the case presentation. A 12-year-old boy from periphery of Lahore was admitted to the emergency department of Mayo Hospital, Lahore, with acute colicky, periumbilical, abdominal pain not referred to other sites, vomiting and constipation for 3 days. On physical examination, he had pallor and appeared poorly nourished. His oral temperature was 37.5 degrees centigrade and BP was 100 by 60 mmHg. Pulse was regular with a rate of 120 beats per minute and respiratory rate was 35 per minute. Abdominal examination revealed abdominal tenderness, rigidity in the center and mid-abdomen. There was no organomegaly. Rest of the systemic examination was unremarkable. At the time of admission, the laboratory investigations were done. The RBC was found to be 3.4 to 3.8 and hemoglobin was 10 gram per 100 ml. The TLC was raised with 13 figure and eosinophils were also increased. Abdominal ultrasonography demonstrated parallel paired lines like railway tracks in the intestinal lumen that was suggestive of worms. The boy came from a very low socioeconomic status family. His father was a farmer and all the family helped the father, usually spending all the day working in the field. They usually ate vegetables from the field without washing. The boy had a history of pica. A Ascaris lumbricoid infection was suspected as the patient's mother gave a history of expulsion of one very big worm from the ear shortly before coming to the hospital. Now, introduction. Ascaris lumbricoid is the largest nematode parasitizing the human intestine. It is an intestinal worm found in the small intestine, mainly in the jejunum and upper part of the ileum. They are more common in children than adults, and as many as 500 to 5,000 adult worms may inhabit a single host. Global burden. Infection happens all over the world. The egg from the parasite are passed in human feces and can contaminate the soil. The eggs survive best in warm, humid areas and grow in the soil before they can infect others. And most cases occur in tropical and subtropical areas of Asia, Sub-Saharan Africa, and the Americas. The global burden of Ascariasis in 2019 was 754,000 daily adjusted life years and a total of 2090 deaths. An estimated 807 million to 1.2 billion people in the world are infected with this Ascaris lumbricoides. Now, epidemiological features. Agent is Ascaris lumbricoid, which lives in the lumen of a small intestine. Sexes are separate. Female measure 20 to 35 centimeter in length and male is shorter, that is 12 to 30 centimeter. Reservoir of infection is male. Only man is the reservoir. Infective material. Feces contained in the fertilized eggs. Host. Infection rates are very high in children. They are the most important disseminators of infection. However, adults seem to acquire some resistance. Roundworms rob man of his food and may possibly compete for vitamin A in the intestine. And unfortunately, they contribute to malnutrition, especially in children who may show growth retardation. Environment. Ascaris is a soil transmitted helminth. The eggs remain viable in soil for years under favorable conditions, and a low temperature inhibits the development of eggs. Human habits. Seeding of the soil by Ascariasis eggs takes place by human habit of indiscriminate or open air defecation. And this is the most important factor responsible for the widespread distribution of Ascariasis in the world. Period of communicability until all fertile females are destroyed and stools are negative. Incubation period is 18 days to several weeks. This is the life cycle. Here we can see that these are the unfertilized eggs in the soil which turn into fertilized eggs, then embryonated egg with LT larva, then there is ingestion of embryonated eggs and hatch larva enter circulation and migrate to lungs, and the larva are coughed up and swallowed, re-entering the GIT. Maturation proceeds in the small intestine. Clinical features in the lung phase, it is presented as coughing, wheezing, shortness of breath, and it cannot be diagnosed. Intestinal phase is presented as vague to severe abdominal pain, nausea, vomiting, weight loss, malnutrition, diarrhea, and bloody stool. Complications are that if there is gallbladder obstruction due to gallstones, intestinal blockage and perforation, pancreatitis. Diagnosis depends on identifying worm or egg. The stool examination for seeing the adult worm or eggs, sputum examination for seeing larva during migration in the lung, and eosinophilia is an indicator on parasitic infection. However, macroscopic identification of eggs in the stool is the most common method for diagnosing intestinal ascariasis. Treatment. Antihelminthic medications that remove parasitic worms from the body, such as albendazole and mebendazole, are the drug of choice for treatment, regardless of the species of worm. Infections are generally treated for 1 to 3 days. Now, moving on to prevention and control, the best way to prevent people from getting this ascariasis from humans is always to do the following. Avoid ingesting soil that may be contaminated with human feces, including where human fecal matters, wastewater, manure is used to fertilize crops. Washing hands with soap and water before handling foods. Washing hands with soap and water after touching or handling the animals, cleaning them. Teaching children the importance of washing hands to prevent infection. Supervising children that are around the animals, ensuring they do not put unwashed hands in their mouth. Washing, peeling, cooking all raw vegetables and fruits before eating, particularly those that have been grown in soil that has been fertilized with manure. Transmission of Ascaris lumbricoid infection to others in a community setting can be prevented by not defecating outdoors, effective sewage disposal systems. Now, this is our second topic, hookworm. Case presentation. A 54-year-old male was admitted because of having suffered from progressively watery diarrhea for 12 days. He had no history of diabetes mellitus, hypertension, heart disease, organ transplantation, or malignancy. After admission, he still complained of diarrhea along with anorexia despite medical treatment. The labs shows leukocytosis with eosinophilia, and stool examination by the concentration method was negative 4 times. When a sigmoidoscopy was performed as a part of explorative survey, a single protruding mass consisting of a moving adult hookworm was found. The fifth stool examination by the concentration method identified hookworm ova. The patient was treated with oral mebendazole 100 mg twice a day for 3 days, and the diarrhea and eosinophilia subsided after this treatment. Now, introduction. It is widely distributed in tropical and subtropical countries, and it is one of small intestinal nematodes, and it is the very important cause of iron deficiency anemia. And it is named a hookworm because anterior end of adult worm is bent, and it belongs to family Ankylostomatidae. And there are two important human species, that is Ankylostoma duodenale and Necator americanus. Now, global burden. Almost eradicated from Europe and the USA. Hookworm infection is still seen in warm, moist climate in tropical and subtropical regions like Asia, Africa, Central and South America, and South Pacific. Worldwide, it infects an estimated 576 to 740 million people. Although most of those affected are asymptomatic, some may experience anemia and other complications. Agent is adult worms which live in small intestine, mainly jejunum, where they attach themselves to the villi, and eggs are passed in the feces in thousands. Reservoir. Man is the only important reservoir. Infective material feces containing the ova of hookworm. However, the immediate source of infection is the soil contaminated with infective larvae. Period of infectivity is that it is as long as the person harbors the parasite. Age and sex. All ages and both sexes are susceptible to infection. However, in endemic areas, the highest incidence is found in the age of 15 to 25 years. Nutrition studies indicate that malnutrition is a predisposing factor. Chronic disabling disease does not occur in the otherwise healthy individual who is well nourished and whose iron intake is adequate. Now, this is the life cycle of intestinal hookworm, where we can see that the rabiform larva hatches from the eggs in feces, and then it develops to filiform larva environment, and then it penetrates the skin. This is how it infects the human. And then larva exit circulation in the lungs. They are then coughed up and swallowed. Now, occupation. It is to be expected that hookworm infection will have a higher prevalence in agricultural than in town workers, and in many tropical countries, it is an occupational disease of the farming community. Clinical features. It can cause logarithmia, macules, papules, bronchitis, pneumonitis, eosinophilia, anorexia, epigastric pain, GI hemorrhage, iron deficiency anemia, hyperproteinemia, edema, and cardiac failure. Now, diagnosis and treatment. Diagnosis, maybe that a standard method for diagnosing the presence of hookworm is by identifying hookworm eggs in a stool sample using a microscope. Treatment is that antihelminth medications such as albendazole and mebendazole again is the treatment of choice for these hookworm infections, and they are generally treated for 1 to 3 days. However, iron supplements may also be prescribed if the infected person has anemia. Prevention and control. The best way to avoid hookworm infection is not to walk barefoot in areas where hookworm is common, where there may be human fecal contamination of the soil. Also avoid other skin contact with such soil and avoid ingesting it. Infection can also be prevented by not defecating outdoors and by effective sewage disposal systems. Now, this is our third topic, that is whipworm Trachuris tacuri case presentation. A 7-year-old boy was brought to the emergency department from one of the remote area of Sindh with complaints of increased stool frequency, about 12 to 14 stools per day, along with mucus and blood in stool, followed by some protrusion of anal mass. Laboratory tests showed mild eosinophilia and blood tests. The patient submitted a fecal sample, which was concentrated and examined following standard laboratory protocols. There were no worms in the feces, but the examination with the iron wet mount showed the presence of yellowish-brown eggs with two polar plugs that resembled trichuris. The average size of the egg was 90 micrometer in length. Based on these findings, this case was diagnosed as Trichuris tacuri infection. Global burden. Most of the disease burden is seen in tropical climates, especially in Asia and less often in Africa, South America. However, it is also found in rural parts of the US. It is estimated that worldwide there are between 450 million to 1 billion active cases, with most diagnosed in children. Worldwide, almost half of the 5 billion that live in developing countries are infected with at least one soil transmitted species, and 10% with two or more. Young boys tend to be more affected as they are more likely to play outside and exhibit packer behavior. A whipworm infection, also known as trichuriasis, is an infection of the large intestine caused by parasite Trichuris tacuri. This is commonly known as whipworm because it resembles a whip, and it is the third most common soil-transmitted helminths. And this infection can develop after ingesting water or dirt contaminated with feces containing whipworm parasites. Whipworm morphology, that the adult worms resemble the whip, and the interior 3 by 5 of the end is very thin hair-like, and posterior is thick and stout, resembling the handle of a whip. The interior end penetrates the mucosa and remain deeply embedded. Incubation period from ingestion of egg to appearance of egg in stool, which is 60 to 90 days. This is the life cycle of the Trichuris tacuri. Here we can see that the embryonated eggs pass in feces, which convert it into two-cell stage, then advanced cleavage, and the embryonated eggs are then ingested by the man. Clinical features. They range from asymptomatic to physical weakness, anemia, stunted growth, cognitive deficit, stool frequency, nocturnal stooling, Trichuris dysentery syndrome, Trichuris collatus, and very important, that is rectal prolapse. Complication is Trichuris dysentery syndrome, which can be found in children and is seen when there is a very high worm burden. This often leads to diarrhea, tenesmus, iron deficiency, anemia, poor growth. The poor growth is typically secondary to poor nutrition, consequently causes cognitive delay. Diagnosis. Diagnosis is made by microscopic examination of stool. The characteristic lemon-shaped egg with clear opercula at both ends are readily apparent. When anoscopy, proctoscopy, colonoscopy is done for other indications, wiggling adult worms may be seen protruding into the bowel lumen. Treatment. It is effectively treated with albendazole, mebendazole, or ivermectin, which is given for 3 days. and mebendazole has shown to be more effective and is considered first-line treatment. Prevention and control: avoid contact with soil and may be contaminated with human feces, including human fecal matter. Washing hands with soap and water before handling food. Treating children. Importance of washing hands to prevent infection. Washing, peeling, and cooking all raw vegetables and fruits before eating. And transmission of infection to others can be prevented by not defecating outdoors and effective sewage disposal system. Anti-Hellman's treatment in pregnancy, lactation, pediatric patients. In mass prevention communication for which the WHO determined that the benefit of treatment outweighs the risk, WHO allows use of albendazole in the second and third trimester of pregnancy. Lactation: it is not known whether albendazole excreted in human milk, however, it should be used with caution breastfeeding women. Pediatric patients, the safety of albendazole in children less than 6 years old is not certain. Studies of the use of albendazole in children as young as 1 year old suggest that its use is safe. According to WHO guidelines for mass prevention campaigns, albendazole can be used in children as young as 1 year old, and many children less than 6 years old have been treated in these campaigns with albendazole. Mebendazole, again, in pregnancy, WHO allows its use in the second and third trimester of pregnancy, and in lactation, it should be used with caution. Pediatric patients, there is limited data in children aged 2 years and younger. So mebendazole is used as an antihistaminic medicine on the WHO model list of essential medicines for children to be used for up to 12 years of age. Preventive chemotherapy for STX. In developing countries, group at risk, high risk for these worms are often treated without a prior stool examination. Treating in this way is called preventive treatment. The high-risk group identified by WHO are preschool, school-age children, women of childbearing age, pregnant women, second, third trimester, lactating women, and adults in occupation where there is high risk of heavy infection. School-age children are often treated through school health programs, and preschool children, pregnant women at visit to health clinics. Now, what is mass drug administration? The soil-transmitted helminths, sometimes treated to mass drug administration, since the drugs are safe and inexpensive or donated, entire risk groups are offered preventive treatment. And this is conducted periodically, commonly with drug distributors who go door to door. Multiple neglected tropical diseases are often treated at the same time using this method. WHO recommended medicines. These are albendazole, mebendazole, which are very expensive, inexpensive, effective, easy to administer, and they have been through extensive safety testing and have been used millions of people, few and minor side effects. Now, recent updates. Global target. There are 6 2030 global target for STH, achieving and maintaining elimination of STH morbidity in preschool and school-age children, reduce the number of tablets needed in preventive chemotherapy for STH, increase domestic financial support to preventive chemotherapy, establish an effective stage control program in adolescent, pregnant, lactating women, establish an efficient strangulars control program in school-age children, ensure universal access to at least basic sanitation hygiene by 2030 in STH endemic areas. Now, this is an article titled as Yin and Yang of Soil, Human Soil Transmitted Helminths Infection. According to it, anti-Helminths drugs do not offer long-term protection, so vaccines are urgently needed, but none are yet available. A major challenge to vaccine development is the parasite's ability to modulate immunity. The immunoregulatory prowess of STH reside within their molecular moieties. STH immunoregulatory molecules are being investigated as novel biologics for treating inflammatory diseases. Advances in vaccine development for human trichuriasis. Despite the implementation of mass drug administration of anti-helminthic treatment to school-age children, trichuria infection remain challenging to control due to low efficacy of current drugs as well as high rates of post-treatment reinfection. Thus, the development of vaccine would induce protective immunity and reduce infection rate. So hurdles for human whipworm vaccine development include the lack of suitable vaccine antigen targets and animal models for human trichuria infection. Now, this is the baseline survey report of soil transmitted helminths prevalence in Pakistan. This is the survey followed by WHO guidelines and use the Sentinel school method in ecological zones to determine prevalence. According to it, much of the southern regions of Pakistan is free of these helminths, with the notable exception in southwestern Sindh, centered around the Karachi area and extending into limited area in southeastern Balochistan. It is mostly confined to the northern areas of the country with the highest prevalence found in area around Rawalpindi and Islamabad. And this is the map of Pakistan showing the disease burden of three worms. This is the distribution of helminth infection roundworm. We can see that it is more concentrated towards the northern parts. Then this is the distribution of whipworm, and this is the distribution of hookworm infection. Now moving on to MCQs. MCQ number one, an 8-year-old boy was brought to the pediatric OBT from a very remote area of Punjab with complaints of anorexia, nausea, vomiting, along with abdominal pain. On examination, there were rashes all over the body. Her mother also complains this issue of pica. Which of the following could be the causative agent for his condition? Ascaris lumbricoid, Nicator americans, and Calostoma duodenal, Tracheuris trachuri, Gardasis.
A.
Yes, A is the right option. MCQ number 2, Ascaris lumbricoid is an intestinal worm that lives in small intestine of man. Each of the following statement concerning Ascaris lumbricoid is correct as sir. Ascaris lumbricoid is one of the largest nematode. Ascaris lumbricoid can cause pneumonia. Both dogs and cats are intermediate hosts of Ascaris lumbricoid. Ascaris lumbricoid is transmitted by ingestion of eggs, and E is they cause malnutrition in children. C is the
B.
right option. C. MCQ number 3. Ascariasis, hookworm, whipworm are known as soil transmitted helminths because infection spreads through the contaminated soil. Which of the following is not correct regarding helminth infestation in pregnancy? The infection could be detrimental during pregnancy due to maternal anemia. The treatment should be with her till delivery because of adverse effects on baby. The treatment can be given last trimester of pregnancy. The benefits of treatment are greater than adverse effects caused by worm infestation.
B.
Yes, B is the right option. MCQ number 4. Which of the following helminth enters the body of a man whose skin of his feet if he walks barefoot in the contaminated soil? Ascaris, Ankylostoma, Schistosoma, Wuchereria, Tracheuris. B is the right
B.
option. Yes, B is the right option. MCQ number 5. Roundworm infection is the most common type of worm infection in the world, mostly affecting tropical and subtropical regions. Which of the following tests is used to diagnose roundworm infection? Vidal test, Pap smear test, Gravidex test, stool test, blood culture. D is the right option.
D.
MCQ number 6. Yes. MCQ number 6. Soil transmitted helminths refer to intestinal worms infecting humans that were transmitted to contaminated soil. Which of the following is an important cause of iron deficiency anemia in children? Pinworm, roundworm, tapworm, whipworm, hookworm.
E.
D. Yes, E is the right option. MCQ number 7. A 5-year-old boy was brought to emergency department by his guardians with complaints of a mass protruding from the anus associated with pain, incomplete evacuation, bloody mucus, rectal discharge, fetal incontinence. On taking history, parents said that they were living in Kachi Abadi of Lahore in a small house with no proper sewer system. Which of the following helminth could be responsible for his condition? Pinworm, roundworm, tapworm, whipworm, hookworm.
B.
D. D is the right option, whipworm. MCQ number 8. The farmers and gardeners are susceptible to hookworm infestation because of working with barefoot and so having direct contact with soil. All of the following statements concerning hookworm infection are correct except hookworm infection can cause microcytic anemia. Hookworm infection is required by humans when willfully formed larvae penetrate the skin. Hookworm infection is caused by Nicator americans. Hookworm infection can be diagnosed by finding the trophozoite in stool. Any guess?
C.
B is the right option. MCQ number 9. In developing countries, groups at high risk for soil transmitted helminth infection are often treated without a prior stool examination. Treating in this phase called preventive treatment or preventive chemotherapy. All of the following are high risk groups as identified by WHO except preschool children, pregnant, ready, second and third trimester, farmers working agricultural lands, teenage females, school going children.
B.
D is the right
D.
option. D. MCQ number 10. Soil transmitted helminth infection among the most common infection worldwide affect the poorest and most deprived communities. They are transmitted by alligator pass in the feces of infected people. Which of the following is not correct about their transmission? Direct person-to-person transmission can occur through coughing by an infected person. Larvae can penetrate the skin if someone is walking contaminated soil. By drinking contaminated water, eating raw fruits and vegetables, pica can lead to infestation.
A.
Yes, A is the right option. This is the key of MCQs. This is the YouTube link of the presentation. And thank you.